Ovarian, fallopian, and primary peritoneal carcinoma are one of the most difficult cancers in the clinical management every day. There's no screening method established. Most patients will be diagnosed in an advanced disease, what means that they have stage 3, according to the FIGO classification, with metastasis outside the pelvic region. Surgery is one of the most important cornerstones to reduce the tumor load, and subsequently the patient receives a chemotherapy within 18 weeks in combination with target therapies, but most of the patient will relapse within the first 2 or 3 years after primary diagnosis. And in relapse ovarian cancer, there's generally no cure anymore possible. We have different treatment options, but they never have been randomized directly, so we don't know which patient will really benefit from each treatment regarding tumor control rate, progression-free survival, overall survival, but even with regards to side effects, toxicities, alopecia, nausea, hematologic side effects. And that's the reason we need predictive tests, ideally before we do surgery, for instance, in relapse setting, to discriminate the best treatments who will help from the treatments who will harm the patients. So in Charité, we are looking for a better predictive test to be much closer to what we want, a personalized, targeted, tailored treatment. And that's the reason why we introduced a new study, a new project in collaboration with the Techniker Krankenkasse, a German insurance company. And we are really happy to look on germline predictive markers, but even to look on tumor biological characteristics in the tumor samples to predict toxicity and efficacy. And I'm very happy that Professor Breiker take the lead to introduce this trial. And I ask you to explain the introduction and the inclusion and exclusion criteria for this project.
We have this new project which is actually aimed for patients with ovarian cancer, with peritoneal cancer, or with fallopian tube cancer. And what we are doing here, we are actually sequencing the tumor tissue in order to obtain more information about which therapy is better for this patient. The project is the first project in Germany in collaboration with an insurance company, so giving us even the possibility to apply maybe for off-label therapies, and the analysis will take part at the Charitè in the Institute of Pathology by Professor Hummel, and we will always need a tissue, a paraffin-embedded tissue samples. Mostly, we would love to have a tissue from the current relapse, but if not possible, if a biopsy is not possible or a surgery is not possible at the moment, the tissue from the first diagnosis is enough because most of the mutations are constant during the evolution of the disease. And we will analyze more than 600 genes, and we will get a little bit more information, hopefully, that's to decide on a personalized medicine. For the moment, as Professor Sehouli already said, that this project is going with a Techniker Krankenkasse, the insurance company, which allows us also to apply for off-label therapy for these patients. And we hopefully will get more insurances that will join these projects and allows us to give this treatment and this opportunity to most of the ovarian cancer patients.